Hi, everyone. So in this video, we're going to talk about breathing. Now, breathing is going to consist of really two phases. Now, your book is going to talk about breathing in terms of these two phases. It's also going to refer to it as pulmonary ventilation. Okay, that basically just means getting air into the lungs, so into the lungs, so that's pulmonary, and then getting that same air out. So ventilation is going to be moving air in and moving air out. Those are the two cycles as well. So getting air in, we tend to call inhalation. Your book is going to call it inspiration. Expiration will be getting that air out. So we're actually going to see some of those words again in reference to some of the muscles, or at least some of the individual mechanisms once we get a little closer, okay? Now, what you need to understand is that we breathe a little differently whenever we are breathing quietly, whenever we're taking kind of forced breathing, okay? So as you're sitting here watching this, I want you to take a couple of, just think about what you're doing whenever you just take a normal breath. So just your normal breaths in, normal breaths out, okay? That sort of rhythmic breathing just at rest, we tend to call this eupnea, okay? This is just our quiet breathing. Now, think about which muscles, or kind of feel for which muscles are moving kind of as you're doing this. Now, this sort of breathing is really just here to make sure that we're getting oxygen into the alveoli and getting oxygen out to the tissues, and then bringing any waste products, particularly CO2, from those tissues out into the blood, so that then we can get rid of that CO2 that those tissues have produced, okay? So those are the main things that we're trying to do when we are breathing. We're trying to get oxygen in and get that oxygen to our tissues, and then we're also trying to remove CO2 waste products from the tissues and get that out. So those are the two main things that we're trying to do. Now, as you can imagine, the amount of CO2 that we're going to produce, as well as the amount of oxygen that is needed, is going to drastically increase whenever we do things like exercise or anything like that. So whenever we do that, we're going to have to, well, change how we're getting air in, because we're going to need more air. Now, both of these things, though, are going to rely on us changing the size of our chest cavity. The larger we can make the chest cavity, the lower pressure we can generate in there, and thus the more air that we can bring in. So under ordinary quiet breathing, we're really only using a couple of muscles. Under big, huge, deep breathing like we're trying to do when we're doing something like, say, exercising, then we're going to, well, have to get more air in. So we're going to have to make those cavities larger, okay? Importantly here, we change the sizes so that we can change the amount of pressure in different places, okay? We want to lower the pressure as much as we can so that we can pull air in, and then we want to squeeze with pressure to push that air out. So that's what we're going to be seeing. Now, all of this is, of course, going to require muscles. Like if I told you to take a deep breath in, you can do that. You can control that, which means we're dealing with skeletal muscles here. We're not just dealing with smooth muscles. We are going to be dealing with skeletal muscles in this kind of respect. Now, whenever we look at muscles for, say, quiet breathing, so what you're doing on an ordinary breath in, ordinary breath out, this is going to come from our diaphragm and our external intercostals. So external intercostals, that's going to be the muscles kind of in here in kind of your chest region, okay? Now, remember, those are going to be on the outsides of your ribs, which means when these shorten, they're going to pull back and they're going to open that chest cavity up. Now, your diaphragm is also down here. So your diaphragm, when it contracts, is going to pull down and thus lower that pressure. So we're making this cavity larger. We make the cavity bigger, so that's going to suck air in. Now, this is just in quiet breathing. Now, on a quiet breath out, the diaphragm just simply relaxes back to up here. So it relaxes, and then those external intercostals also relax. They're not actually squeezing. So when that happens, we're actually just letting those things relax, and it's going to push out any of that air that we breathed in. Now, this is ordinarily going to be on the order of around half a liter. So if you've ever seen like one of those half-liter water bottles, like the 16.9 ounce water bottles that people tend to give away, or at least sell for like $1 or something like that, that's going to be usually about how much air we're breathing in on a steady basis in that kind of quiet breathing. Now, if you take a deep breath, well, that's not a figment of your imagination. That's also not me playing it up too much. When you take a deep breath, you expand everything. Your chest has to open up. It even lifts your ribs. So if we need to lift the ribs to make that cavity larger, we need muscles to do that. So this is where our sternocleidomastoid and our scalenes are going to come in. They're going to pull up on that rib cage, basically creating more distance between the top of the rib cage and the diaphragm, making it larger. External intercostals open things up a little bit more. And we also grab our pectoralis minor muscles, once again, pulling that rib cage out towards our shoulders, okay? And then we also have our serratus and erector spinous. So these are muscles in the back, once again, opening that chest cavity up, opening things up as much as we possibly can. The bigger we can get it, the bigger vacuum we can generate, and the more air that we can get in, okay? So whenever you need to take a deeper breath, that's what we're going to do. We're going to pull in additional air by opening up and opening up and opening out with the chest cavity. Pull it up, pull it out, so we can make the chest cavity as large as we can. The diaphragm will also push down. Now, that is how we're going to get a bunch of air in, and then when these muscles relax, we can get that air out. Now, if we want to push out additional air, so say we want to push out more air, we want to push that air out faster, that means we're going to need to then grab some even more muscles. Now, the muscles that we're going to grab this time are going to be our transversus muscles, so transversus thoracis. So these are clearly some muscles kind of on the inside of the rib cage here. So those are going to help close the rib cage. We also have our internal intercostals, so muscles laying on the inside of the ribs this time. So when they close or crunch, they're going to once again pull your rib cage closed, push that air out. And then we've also got our external obliques and transversus abdominis. So we have muscles in the abdomen. So let's see if we can feel that. So now just push out as much air as you possibly can. When you do that, you should be able to feel the muscles in your abdominal region contracting and constricting. You'll notice like I even kind of pushed down a little bit. By doing that, you're pushing out as much of that air as you possibly can. So it's squeezing on those lungs, trying to like squeeze the air out of a balloon to get as much of that air out as we can, so that we can then take a big deep breath in and kind of bring more air in. So that is how we breathe. And this is all related to volume changes. If you make a bigger volume, you decrease the pressure on it, which means you now have a lower pressure in the chest cavity than you do outside. So that's going to pull air in. So in inspiration, we'd make the thoracic cavity larger. That decreases our pressure, so we can pull air in. When you expire, that means we basically want to squeeze on the chest cavity, make it smaller. So now we have the same amount of air and a smaller amount of space, so we have more pressure. So that's going to force that air out. So that's going to force that kind of CO2 rich air out. And we're going to do this over and over and over again. So we're seeing this both in vertical changes, both lifting the rib cage as well as contracting the diaphragm, so pulling the diaphragm down. Whenever we try and push out, diaphragm squeezes up. We can see this on the side. So this is where we get our external and internal intercostals, as well as our pectoralis minor, things like that. And we also have kind of opening things up in relation to like front to back, so the movement of the manubrium or the sternum as well, okay? So we have lots of moving here to influence where things are going. And this is all gonna be related to pressure. If we have the same amount of molecules in the chest, but we squeeze on them, that means we have a higher pressure on them. Or if we open things up, that means we have the same amount of molecules in a larger space. Now we have a lower pressure. But air wants these pressures to be balanced. And it's going to happen very, very fast, like in the span of a breath. Okay, so that is how we breathe. So if you have any questions about kind of the mechanisms of breathing or anything like that, please, please, please just let me know. Thanks. Bye.